So how do you treat pain in MS? Aaron Boster here, and thanks for learning about MS with me. So how do you treat pain in MS? It is a fool who thinks that he can treat pain with only a pill. And in my experience, in order to be successful in treating pain, we have to use a multi-pronged approach. We have to use lots of different techniques to control pain. So we're not just going to use a medicine. We're going to use everything at our disposal. And in my mind, that starts with behavioral measures. So number one, sleep. If you are a bad sleeper, you will have more pain. And if you have a pain syndrome and you don't get enough sleep, it will hurt more. And many, many red-blooded Americans are profoundly sleep deprived. We're going to bed at midnight. We're waking up at 6 in the morning. We're getting 6 little hours of sleep. We're getting up twice at night to go pee, and we're snoring and have sleep apnea. And the quality and the quantity of our sleep is really bad. And you know what? That makes pain worse. So you can make pain better simply by sleeping better. And I'm being very serious here, guys. This is a pro tip to improve pain by improving sleep. The next thing is eating. So sometimes we eat a lot of fast food and processed food and sugar-laden foods. And eating good, healthy, nutritious food and eating at regular intervals so that you maintain stable blood sugar and insulin levels can help with a lot of things, including pain. And so if you're suffering from pain, I challenge you to cut out fast food and pop. I challenge you to cut out foods that have ingredients with words you can't pronounce and lots of chemicals. And I challenge you to cut sugar out of your diet. And I bet you $1 that you're going to notice that your pain is better. I've seen this anecdotally many, many times in my clinic. And increasingly, I'm starting to believe that it's really a key to minimizing symptoms in MS. So take that for what it's worth. Just my opinion. So the next thing I want to talk about is tobacco, smoking. There's good studies that demonstrate that smoking cigarettes increases pain. Take it for what it's worth. But if you have a pain syndrome and you're smoking cigarettes, you can actually minimize or decrease your pain by not smoking. So there's a lot of reasons why not smoking is healthy for you. Many of you know that I have the concept of being 4 for 4 in your fight against MS. And one of those 4 things is to not smoke cigarettes. And if you have a pain syndrome, it may help with pain. So the next behavioral thing I want to talk about is stress. Now, nobody goes home at night and says, "Honey, let's get stressed out." That's just not a comment that you'll ever hear in your house. And yet stress is prevalent. Sorry, I didn't mean to jostle the camera. Stress is very prevalent in our lives. And I hate it. I can't stand it when doctors say, well, just remove the stress, as if like, you know, you could take your glasses off and that's removing the stress or something like that. That's nonsense. But we can learn to manage stress. We can learn to reduce and minimize stress. And the reason I bring it up is increased psychosocial stressors, increased life stress is going to increase pain. And so if you can minimize the stress in your life, you'll also minimize your pain. The last one I want to talk about is a sedentary lifestyle. The less you move, the more you hurt. This is a fact. And if you're not moving around very much, you're going to hurt more. And so if you're able to walk, walk. And if you can't walk, but you can get in a pool and move around, do it. And if you can't do that, have someone stretch out your limbs. But the more you're still, the more you're going to hurt. And so I've just gone over a couple behavioral techniques: sleep, nutrition, avoiding tobacco, managing stress, and addressing a sedentary lifestyle are all excellent tips to help someone minimize their pain. And I'll have you notice that most of them are free and they're not involving a medicine. So now let's shift our attention to non-medical pain treatments. So now we're honing in on pain, and these are things that are not medicines. So the first one is exercise. Now, again, going back to my 4 for 4 concept, one of the 4 is to exercise. And if you're not exercising as part of your lifestyle, you're going to hurt more. Now, someone may say to me, "Doc, you don't get it. I hurt so bad, there's no way on earth I could exercise." And whereas I understand, I hear you that it hurts, If you can get yourself to exercise, if you can get yourself to move, you will reduce your pain. Go for a walk. If you can't walk, get in a swimming pool and walk laps in the swimming pool. But exercise is a pain reliever. And if you hurt, I don't want you to hurt. And I want you to use every modality possible to not hurt. And exercise is an awesome one. Physical therapy can help with pain. And aquatic physical therapy, I think, is the bomb diggity when it comes to treating pain. There's something magical about being in a pool. The water does a lot of things for spasticity and for balance and for heat, and it can really, really help. And so I would encourage you, if you're looking for a form of exercise and you're not sure, consider an aquatic therapy, whether that be water Zumba or water aerobics or doing swimming or even just walking laps in the pool. That can be a secret weapon. Acupuncture is another example. Now, acupuncture in the United States is sometimes considered complementary. Allopathic doctors like myself, we weren't taught about acupuncture in school, and we think it's a complement to our type of medicine. Now, if you travel to the other side of Earth and you talk to folks in China, they don't think it's complementary. It's a standard of care and has been for thousands of years, I think. And there is some evidence that acupuncture can help with pain. Cupping. I was talking to my partner, Dr. Nicholas, recently. We were actually doing a podcast, and she brought up that some of her patients, anecdotally, have found cupping to be helpful. Now, I don't have any personal experience with cupping, but I would be curious what you guys think. So if any of you watching the live stream have found value or just tried acupuncture or tried cupping, leave a comment and let us know what your experience. Good, bad, or ugly, I would love to hear about it. And the other people that are viewing this would also love to hear about it. What else can you do to treat pain that's not a medicine? Yoga. Yoga has been shown to help with pain. Meditation helps with pain. Mindfulness training helps with pain. Now, mindfulness training sounds maybe kind of hocus pocus until you try it. And if you're poo-pooing the idea of mindfulness, it makes me think that you haven't tried it yet. And I challenge you, do a Google search for mindfulness or mindfulness training and take a crack at it. Centering yourself, existing in the moment, becoming aware. These are things that can have a really, really big impact. You know, there are people that find that their pain is better when they go out in the woods and, you know, their cell phone doesn't work and they're not on the interwebs and they're at peace and they're meditating and they're in a forested environment. And that can be profoundly therapeutic. Again, I'm not proud. I'm not telling you this is the answer. I'm saying I want to do anything and everything that we know how to do to make your pain better. And mindfulness training is something for you to look into. Biofeedback is a way of helping you understand your body's responses and how to modulate them. And so I've had some patients using biofeedback to minimize their pain. The last non-drug therapy that I'll talk about is psychotherapy. So specifically cognitive behavioral therapy. There are talk therapies working with a counselor to manage pain. And again, before you poo-poo that, I would certainly try it. If you show me someone who's hurting, I'll show you someone who is stressed about it, depressed about it, and struggling as a result. And learning how to manage that with a trained listener, with an expert listener, with a therapist can be really, really life-changing. So we've just gone over some treatments for pain. I talked about behavioral treatments, and then I talked about non-drug treatments. And after this sip of water, I'll start to talk about treating with neuropathic pain medicines. Neuropathic pain medicines are medicines that treat the type of pain that we've been talking about on this live stream. Pain coming from the brain, spinal cord, or nerves. And they're oftentimes invented for other purposes and then later found to help with pain. And I'll give you a great example. Tricyclic antidepressants, or TCAs. These are medicines like amitriptyline, nortriptyline. Trade names are Elavil and Pamelor. And these medicines were invented to treat depression. And they're like okay antidepressants. But they are really, really good pain medicines. They're excellent pain medicines for neuropathic pain. Neurologists prescribe them more than psychiatrists because there are probably better antidepressants out there, but these medicines are excellent for treating neuropathic pain. We use them all the time when we're treating a burning leg, or we're treating a painful sensation in the hand, or when we're treating migraine headaches. It's a medicine that's typically dosed only once a day before bed. They have side effects of sedation. So if you have insomnia associated with your pain, that's a great 1-2 punch where you get a little bit sleepy. It helps you go to bed at night, and also can help with pain. There are other antidepressants that can help with pain. Cymbalta is an example. Duloxetine is the real name. Cymbalta has a dual indication by the FDA. It's approved for pain and it's approved for depression. Now, why do I like Cymbalta? I like Cymbalta because if you show me someone who's in pain, I'll show you someone who's depressed about being in pain. And so it's the rare human being that is hurting really bad and not feeling sad about it. And so I think that the advantage of Cymbalta or other antidepressants is that it does a 1-2 punch in a different way. It treats the pain and it treats the mood problem caused by the pain. And so that's an example of a fantastic medicine. Now, there are a lot of medicines to treat neuropathic pain that were invented to treat seizures. And earlier in the live stream, I talked to you about that. And I explained that a seizure is an inappropriate electrical storm on the brain. And taking a seizure medicine quells that electrical discharge. If you have neuropathic pain, it's also transmitted by inappropriate electrical discharges. And so taking a seizure medicine helps treat that neuropathic pain. And there's many, many seizure medicines that I've already listed earlier on the live stream. Things like carbamazepine, Tegretol, which we talked about for Vermeer's phenomenon. I also talked about Topamax, or if I haven't, I'll talk about it now. Topamax, or topiramate, is a medicine that's invented to treat seizures. It also has an FDA indication for pain. Topamax causes weight loss. And so if you're struggling with weight and you have neuropathic pain, sometimes that's a great 1-2 punch where it'll help with the neuropathic pain and it'll facilitate weight loss. Now, obviously, every single medicine I'm talking about has side effects, and I'm not going to go into the details, but these are medicines that you need to work out with your doctor to make sure that they're safe and appropriate for you. Many of you have heard of the medicine Neurontin or gabapentin. Gabapentin is a seizure medicine, and it's used for seizures infrequently. It's used to treat neuropathic pain all the time. I love using Neurontin to treat neuropathic pain. And one of the advantages of Neurontin is you can take it up to 4 times a day. So some people only need to take it before bed. Some people literally take it when they wake up, at noon, and after dinner, and then before bed, because they need coverage all day long. And Neurontin comes in all kinds of different doses, so you can use a little dose or a really, really big dose. There's another medicine which is sort of like the son of Neurontin called pregabalin or Lyrica. And Lyrica is dosed once to thrice daily. And it's another medicine originally invented to treat seizures that is the bomb diggity to treat pain. So there's others that we could talk about, but I just wanted to share with you that these medicines are highly effective in treating the kind of pain that we see with MS. Now, before I start talking about medicine by Edison, I want to make a couple comments about narcotics. Narcotics are a very bad treatment for chronic neuropathic pain, particularly fast-acting narcotics. So morphine, oxycodone, OxyContin are awful for treating neuropathic pain. It's really bad. There's a lot of things that happen with acute narcotics that are very problematic. So when you take a narcotic, what you're doing is you're blocking the pain receptor. So your body makes more pain receptors, which makes you more sensitive to pain and requires a higher dose of narcotic. And so you can develop a dependence and a tolerance. Also, narcotics are notorious for making you constipated. And if you're FOS, full of stool, that can increase pain. And so I think using narcotics to treat neuropathic chronic pain is a really, really bad idea, with one caveat. Now, I have a good friend up in Michigan. She's a professor up there, and she just finished a palliative care fellowship, which is kind of cool. And one of the things that she told me is that I need to learn about methadone. Now, I don't use methadone in my practice. Methadone is a long-acting narcotic. And according to my friend, I need to learn about methadone to treat chronic neuropathic pain because she has found in treating terminally ill patients and cancer patients that it works really well. So I need to learn more about that before I can bring it to my clinic and my patients, but that's on my list of things that I need to get up on methadone. I'm going to shift gears now and talk about medicine by Edison. What do I mean by medicine by Edison? I'm talking about electricity. One of the really cool ways of managing neuropathic pain, particularly pain from your spinal cord, is using a spinal cord stimulator. And if any of you that are tuned in right now or watching the replay later have experience with a spinal cord stimulator trial or a spinal cord stimulator in and of itself, please leave comments below. What you're doing with a spinal cord stimulator is you're putting two very thin wires on either, if this is the spinal cord, on either side of the spinal cord. And then you're sending electrical messages between the two wires and you're canceling out pain signals. And this is something which is tested out. You see a pain doctor who does a procedure where they put in these wires and the wires come outside your body attached to a battery that you'd wear on your belt. And you can wear this as a test for a week or two to see if it helps you. And if it helps you, they do a second procedure where they internalize all that stuff. So you have the wires and the battery, but it's under your skin. And you can program it using a computer. And medicine by Edison or spinal cord stimulators can be life-changing. It's a great way of treating certain kinds of neuropathic pain. Now, the last thing that I wanted to talk about, with two last topics, one is using intrathecal pain management. So as I mentioned earlier, I have a lot of experience treating severe spasticity, including using intrathecal baclofen pumps. So a baclofen pump is a pump that's about the size of a dip can or a hockey puck, and it's implanted under your skin with a tube that brings liquid medicine to the spinal sac. And I use it to treat spasticity by putting baclofen in it. Well, expert pain doctors will sometimes use pain medicines in those pumps, and they use microdosing. So instead of taking like oral morphine, where I said that's a horrible idea, they use itsy bitsy tiny doses of morphine that are delivered directly to the thecal sac. And for some refractory pain, using a pain pump can really be life-changing. Last treatment before we wrap up this didactic lecture is cannabis, ganja, marijuana, weed. And there's a lot of anecdotal suggestion that cannabinoids treat neuropathic pain. Now, the data supporting it is not very good when you look at the research. And maybe that's because the research hasn't been done adequately. I'll share with you that I have many, many, many patients that tell me that if they use a cannabinoid product, that it helps their neuropathic pain. And I have a lecture on this channel where I talk in depth about cannabinoids and MS, and I review some of the data on cannabinoids and pain, and cannabis and pain. Today's topic was pain and MS, because MS hurts. And a long time ago when I was in medical school and they told me MS didn't cause pain, they were wrong. And so today we've gone over several different things that can treat pain: behavioral measures, non-medicine measures, neuropathic pain medicines. We talked a little bit about narcotics and cannabis, and we talked about medicine by Edison. Thank you so much for listening in. If you have not subscribed to the channel, please consider doing so. And if you're a subscriber, ring the notifications bell so that when I jump online to do a live stream, it alerts you and lets you know. So until my next time on the internet, my name is Aaron Boster, and I want to thank you so much for learning about MS with me.